to the PeakDay podcast, where we discuss fertility and natural family planning with our friends. Today's guests are Doctors Amber and Paul Day. Dr. Amber Day is a board-certified pediatric physician in Cincinnati, Ohio. She has a heart for service and has worked with underserved populations and has served in mission trips in Jamaica, Trinidad, and Kenya. Amber is an active member of her church as well as the Catholic Medical Association, both nationally and locally in Cincinnati. She's a full-time mom, homeschooling her 3 young children, and also works part-time at a Christian community health center serving pediatric patients in Cincinnati. Amber's husband, Dr. Paul Day, is a family medicine physician in Cincinnati, Ohio. Paul serves on the national board and as the local guild president for the Catholic Medical Association. Paul acts as a preceptor for medical students from the University of Cincinnati in his role as volunteer assistant professor. He is trained in NAPRO, a restorative women's healthcare model, and FEM women's healthcare. Paul fulfills speaking engagements for his local and statewide community regarding various medical topics, especially as they intersect with faith and morals. Thank you, Paul and Amber, for being our guest on the PeakDay podcast.
Wonderful. Thank you for having us.
Yes, absolutely. So how is it with 3 young, busy kids and 2 busy doctors? How's life?
I think that probably the best way to describe it is joyful chaos. It definitely is very chaotic, today being one of those days, but so joyful. Every time things get a little bit tough, someone says something, my 19-month-old will say, dinosaur, which is the way that she says dinosaur, and then you just start to laugh. So I don't want to say that it's all roses, but overall, I think that the overarching theme would be joyful and chaotic.
Yeah, that's a good summary. And I would say, too, we've been very blessed to be able to kind of adjust and transition as each new child has come. Where Amber works, she's been very fortunate to be able to scale back over time to be able to serve our family in the way that they need it. And so she's been able to be with our children a little more as our family has grown, but still keep her physician skills up at the clinic. And so that's been a nice balance for us, I think, to live out that, we call it the small V vocation of being physicians, but prioritize kind of the big V vocation of being parents to our children. So,
Paul, you do speaking engagements, correct?
Mm-hmm.
And why is it important that when you take a speaking engagement that it kind of includes faith and morals along with your medical profession?
The simple answer is because they're both passions of mine, and I really love to see how those intersect. And honestly, it's important to me that a lot of the speaking engagements are based on that, because you really can't have one without the other. The faith and the morals kind of inform the way you approach medicine and you approach, an individual person that you're treating. And so I think sometimes navigating the medical field can be challenging. And so, being able to do that in a way that has that mindset of seeing the dignity of each person really kind of changes our scope and our lens. And so as those kind of specific issues come up and how they look kind of on the granular details, I like to try to translate those for people. And so I guess, I would say it's a passion of mine and important to see through that lens. So,
as a couple, how did you get involved with fertility awareness-based methods and NAPRO in particular, and FEM?
I really think that it was particularly providential. So when I was in high school, I had some cycle irregularities, and I had done a project on a moral dilemma in the faith for my high school religion class, and I went to a Catholic high school. So my assigned topic was contraception. And so I did all this research independently and realized that, wow, the Catholic Church has a beautiful teaching about contraception and being open to life. And so when I was going through some treatment for my irregular cycles, I said, I don't want to be on the pill. I've heard about these wonderful other methods, and I want to go that direction, because my understanding is that it helps to restore fertility rather than just putting a young woman on the pill. So again, by the grace of God, I learned the Creighton method of natural family planning to help chart and diagnose some of my problems. And lo and behold, once we were in medical school, I found out that he had shadowed a doctor who practices natural family planning, the NAPRO technology, and he had shadowed him. And so he started to do the NAPRO technology training course. So I knew that. So when it came time for us to get married, we just kind of knew that was, we shared the same values on that. And so that's kind of initially how I got into it. And then it sort of worked out for both of us.
Yeah, and I was fortunate to be introduced to it. Actually, my sister was having some issues with her health, and was seeing a particular physician who is NAPRO trained, which, as you mentioned, is that kind of restorative women's healthcare model. And so in medical school, I kind of had this conundrum of, I think I know what I want to not do, but what can I offer kind of in place of that? And so, we want to be able to say, not just, no, we can't do that, but also we have something we feel like is perhaps even better. And so I was fortunate to be introduced to him and shadowed him. And that kind of introduced me to the world of kind of the medical application of the fertility awareness-based methods, or NFP methods. And so through that, I was introduced to some different training courses that I've been able to do throughout my training and then early career, and be able to apply those in medical practice.
So speaking of medical school, was there much training for future doctors in women's fertility and natural family planning methods?
Unfortunately, not really. It's something that wasn't really emphasized. I think it was kind of briefly mentioned on a slide, but I think maybe that particular presenter didn't have maybe the best updated information. A lot of times, kind of, old rhythm methods are kind of cited, and so it's kind of essentially a side note or a footnote in the presentation otherwise. And so, fortunately, there were some colleagues that I encountered in medical training that helped me navigate that, but not necessarily part of our curriculum. There's some doctors doing great things now that are trying to introduce that into med school curriculum. That's, I think, really important. So we hope to see that grows for sure.
Yeah, I was actually going to mention there is a physician and a program that allows medical students to take. Well, first of all medical students have some elective time that they're allowed to pick a specialty that they can pursue to learn more about. And so this is an elective program where if they choose, they can take this course and learn more about it. So it is independent and not mandated by any schools or anything, but it is out there and available.
Mm-hmm.
So was there any kind of transition between your formal training and how you actually practice medicine when it comes to treating women's fertility? And was the transition easy or difficult?
I was very fortunate to join a practice where there was another physician already kind of practicing NAPRO, and so there was kind of an openness to that, which sometimes it's not always there, depending on kind of who you're with. And so I felt, I'd say, beyond just being kind of tolerated, if you will, but also I had the opportunity for mentorship and the way to see how that's applied at a very practical level. Because just like anything, there's training, and then there's getting out and practicing and applying it. And so having the mentorship of someone who had been doing that before me was very helpful. So that was I was very blessed to have a pretty smooth transition in that regard.
And I, on the pediatric side of things, don't do as much with the infertility piece, but particularly the issue that comes up a lot with my teenage patients is cycle irregularities. And and then of course young women who want the contraceptives. So when I was in residency, I was working in a clinic. We this all the residents have a residency clinic, and in my particular clinic, we would go see a patient and then go to an attending physician and kind of present the patient and go over our plan, and then they would yay or nay or tweak some things. And the first time that I ever had an issue with a young woman that wanted contraception, and I certainly was not going to provide that. And I wanted to talk more about, what are the reasons, and are you having cycle irregularities, and that I was able to counsel the patient. And once again, by the grace of God, I went to one of the attending physicians and I laid it out and I said, this is what the patient wants. I'm not willing to do this, and I don't feel like it's in the patient's best interest to do this. There are a lot of reasons, and I'm happy to sit down with you at some point. I don't know that right now is the time, but I'm happy to have a conversation with you about that. But this is my plan and this is what I want to do. And she said, "You're a good resident. I like the way that you think. I disagree with you on this. I'm going to help this patient out with her wants." Once I got into practice, I work for a Christian community health center, and everyone is, while not always in agreement about certain practices, very comfortable with the way that I wanted to practice. And a lot of the more seasoned pediatricians didn't do any sort of fertility or pregnancy prevention.
What do you recommend for young girls as they approach their fertile years? But can you elaborate on that a little bit?
I think that the very first thing that they should do is just kind of learn more about their bodies and what that means when they're starting cycling, learning that that's a totally normal thing and that means that her body is working and it's a beautiful thing, and that God has just written upon her body this beautiful ebb and flow to her cycle that can teach her a lot of important information. And so teaching young women to chart, even if it's very rudimentary.
Yeah, and like you said, really just helping them learn what is normal and what is not normal as far as bleeding patterns and cycle length. Even if it's just some young women in their teenage years will just kind of mark in their phone, when they have their period, and keep an eye on that pattern. And that way they're aware of, what's considered healthy normal, so that if they start to see a pattern emerge that they were taught, this isn't quite right, they can come to us and have a conversation. And like Amber said, just kind of address things kind of earlier on, which is really nice.
So are you able to talk with moms or parents about their daughter's fertility at all? Do you have those kind of opportunities?
I'd say we do. And, just like every one reason we love, I think, medicine is every encounter is very different. And so, sometimes it depends on kind of where they're coming from, what their concerns are. So often, it's helpful when we have this primary care relationship with a patient that, usually it's not our first time meeting them. And so one big benefit there is often we have rapport with them. Maybe Amber helped treat their strep throat when they were little, and some different things like that. And so as we grow with them, that usually opens the door to be able to talk about some of these things. So some of it depends on the rapport we have with them, but we encourage the parents, especially the mother, when the daughter is present, to be part of the conversation, because we don't want to replace that relationship. We want to kind of augment or empower that relationship. So we're very much, for including especially the mother in that conversation, to kind of help give them food for thought on kind of probably the more deep and complex conversations they may be having at home, kind of moving forward. So,
Do you ever have a patient bring in an actual chart or her app with her charts on it that she wants to share with you? Is that something that you've experienced?
absolutely. So, especially if they're coming in for cycle irregularities, and sometimes it's seeking to conceive and wanting to have the best for the fertility, but very often it's for other things like pain with their cycles or abnormal bleeding patterns, things like that. And so we often will encourage them to bring in whatever they have for monitoring. And like we were mentioning before, it's really helpful because that is just as important, really, as the lab tests that we get, because it gives us a context and a pattern that we can see. And being able to read the charts really gives us an idea of what's going on with the hormones well before we look at them. So yeah, absolutely, it's an essential tool that we both find really helpful.
How are you able to help somebody who might be more contraceptive minded?
Yeah, that's a great question. And again, I think sometimes that door of opportunity can be more or less kind of wide open depending on that pre-existing relationship with the patient. Um, but often, I think finding out why that is the case, if what the desire is, if there's fear behind that, or if there's just concerns that other methods don't work. So really, it's a lot of asking questions and kind of understanding kind of where that comes from. Um, and I think if nothing else, it very often leads to good conversations and kind of bringing up things about how the medicines work that they are taking versus some other options. And so sometimes, people will say, all right, I'm willing to kind of give this a shot. And other people, maybe we're planting seeds or just kind of giving them information. But one thing that Amber and I talk a lot about is that if we really approach it from wanting what's best for them, even if someone disagrees, they can sense and see that we're not trying to like push an agenda on them. That we see this as the best way to approach things, and that way, if there's a disagreement in that, there's still respect in that relationship, which is really important.
In your experience, are you seeing more women who are having cycle irregularities? And if so, what are your thoughts on maybe the cause of this?
Yeah, that's a good question. It's interesting because I think my lens is focused on that, and often we are sought out for that, so we are going to see more of it. My hope is that if it's there more, that it's because we're looking for it more and there's more awareness of what is normal and abnormal. um, that's true in my hope. There are a lot of factors that are really difficult to isolate, environmental factors, factors with our diet, factors with our genetics that are really difficult to isolate in and of themselves. So I do think it's surprisingly common, because it's not a conversation that a lot of people have with others unless it's a very close friend. So I think it is more common than people realize. As far as an uptick, my hope is that if that's there, that it's because we're looking for it and recognizing that we need to address things. So.
What do you think is important for couples to know about natural family planning from maybe a medical perspective?
Yeah, that's a great question. One is that it's an incredible tool that enables a couple to really understand not just what's going on with fertility, but also, like Amber had mentioned, kind of the ebb and flow of hormones that can impact a number of things in their lives. And so um, it's incredible to me how I will see patients who are able to pick things up, based on their charting, and we're able to work things up and catch things earlier, like a thyroid disorder, or maybe an abnormality of the uterus, that perhaps without charting would have probably gone unnoticed for at least a few more months, if not even longer. Um, and so it helps you be in tune to what your body is doing. It's interesting in medicine, we refer a lot to the vital signs, and there's four main vital signs. You think of heart rate, breathing, blood pressure, and temperature, and really we consider this a fifth vital sign. And I think that's essential because it really gives us so much information. Um, and also the fact that it helps couples navigate different times of their life, because I will see a couple who is, really wanting to have a child, and struggling with their fertility. And then, the next day I will see a couple who have a lot of things going on in their lives that make having a child right then very difficult. but even using an NFP method can be overwhelming to them because perhaps their cycles are irregular and there's other things going on. So it's used in so many ways, and it can vary so much depending on where you're at in life, and what's going on. That the amazing thing of the tool is that it's used, to achieve, to avoid. It's used in ways to help further and catch things with your health, and so it changes depending on where you're at, on how you're using it, and how useful it is for you, which is a beautiful thing.
Do you have any other stories maybe of couples who have been able to use natural family planning successfully?
Yeah, there's so many beautiful stories. I mean, a couple that had worked with us for a couple of years, and they had a lot of things going on with different hormones and needing surgery for endometriosis, and then the husband actually had a severe kind of medical event going on that also set them back in a different way. Um, and then they were just I'm amazed by the perseverance, of some of these couples, because recently they had their baby just a few months ago, and the joy that it has brought them, because not only did they persevere and work hard and go through these hormone workups and a surgery to kind of clear out the endometriosis, but also there's just a trust throughout that process of doing everything they could to optimize fertility, but also leave the rest in the hands of God. And similarly, the trust that some couples have when they say, what, finances are tight, or our stress levels are a little high and we're needing to space pregnancy, but we are going to utilize this method because we know it works. And then sometimes they'll rely on us to make sure that as they're looking at their cycles, they're doing it in a way that they can have that confidence, because we want to help them maintain that marital intimacy, but also kind of have trust that they're in the right hands, that the Lord's taking care of them. And so, yeah, I would say just the perseverance and faith of many of the couples is very inspiring.
Well, thank you, Dr. Paul and Dr. Amber Day, for being on the PeakDay podcast.
Yeah, it was a pleasure. Thank you for having us.
Yeah, God bless you.